Thank you for joining us in our ribbon-cutting ceremony. My name is Arthur Lavoie, and I am very proud to say that I chair the governing board here at DotHouse Health. We'd like to... Thank you. We'd like to acknowledge elected officials in attendance, Senator Linda Dorsina-Fori, and I know our city and state folks are in budget negotiations, so there are, is anyone else? I don't see anyone else in the reserved spaces. So thank you, Senator Fori, and all invited guests and the folks on the podium who are going to have something to say later. I'm proud to be serving my second term as chair of the governing board here at DotHouse Health. The board and I are deeply committed to a concept of healthcare and wellness that includes the whole person. Your support of the health center strengthens our commitment to the Dorchester community. It was a very proud moment for me, and I'm sure for the rest of the folks in the room, when the board, with the help of Walter and his senior team, got together to come to a consensus on this new name. The name DotHouse Health does several things. It names who we are today. It points back to our legacy as a settlement house. And it points us toward the future of who we are becoming. We are really proud that we came together to do this and of this moment when we officially dedicate this name. On behalf of the board, I want to thank each and every one of you for your support today. Without you, DotHouse Health staff, the political and community leaders who are here, patients, members of the community, members of the board, we could not make all the good work that happens here happen without you. We look forward to celebrating our history and our future as DotHouse Health with you. Thank you.
Well, good afternoon, everyone. My name is Jim Hunt, and I'm the CEO of the Massachusetts League of Community Health Centers. I come here to bring you the greetings of the community health centers across Massachusetts and across this nation. Today, Massachusetts Health Centers are the largest primary care network in Massachusetts, serving 989,000 unduplicated patients across Massachusetts. We work closely with hospitals. We work closely with hospitals like Boston Medical Center. We work closely with communities like the board of directors of this wonderful DotHouse Health. A bit of an aside, I can remember playing basketball in this very gymnasium and poaching on the senior lunches when I was a young person, and I wish my son Daniel could be here today because we could play some hoops, but he's debating the budget, but his staff are here, as are representatives of the Baker administration. In particular, community health centers focus on the community governance aspect of the board of directors. And we're going to hear today from Congressman Kennedy, but it was the United States government, the federal government, in 1966 that basically spirited on the community health centers right in this particular space in Dorchester, Massachusetts. Columbia Point Health Center was opened in December of 65, and in 1966, Senator Kennedy went to Columbia Point. He saw what was happening there, and he went back to Congress and said, we need to do this across America. Today, there are over 3,000 community health centers serving 23 million people in America, regardless of their ability to pay. And each health center is unique. DotHouse is unique from Geiger Gibson or from Harbor Health or Bowdoin Street, but they serve constituencies that basically reflect the communities that they serve. The federal government has invested in community health centers. The federal government, through the Affordable Care Act, has helped to empower people to basically get the primary care they need in a setting that's appropriate and certainly at the right price. So today, community health centers continue in Massachusetts and beyond. I'm looking at our former Secretary, Phil Johnston, who basically spirited on the growth of health centers here in Massachusetts and made those kinds of investments that Linda Dorsina-Forey and her colleagues and others continue to make in community-based primary care. Senator Kennedy once said to me, you know, Jim, if we didn't have community health centers, we'd have to invent them. And I basically get credited with saying, if you've seen one health center, you've seen one health center, but I think that came from him too. But this health center, like all of our health centers here in Massachusetts, is very special. I congratulate the Board of Directors and you, Mr. Chairman, Walter Ramos, our CEO, and the staff of this great health center that puts it all together to make primary care available in this community in the language that people speak, regardless of their ability to pay, in connection with some of our greatest institutions all across this city and in this Commonwealth. So thank you very much for what you do.
My name is Walter Ramos. I'm the CEO here of DotHouse Health. I want to thank each and every one of you for joining us here for this momentous occasion. To elected officials, I know a representative from Representative Hunt's office is here. Sorry we weren't able to acknowledge you earlier. Our members of the board who come time in and time again to help us run this institution, all volunteer. Thank you for being here today, and thank you for all the work you do for DotHouse Health. So you may be wondering why we've changed this long-standing name of Dorchester House Multi-Service Center. Well, it starts with the very room that you are in right now. This is an institution that not only takes care of the health of each individual, it takes care of the health of the community. In this very room, youngsters come after school, they come during the summertime, they come during school vacation, and it's a safe place to recreate. It's a place where their parents can feel comfortable, that they're in a familiar environment, and that they can feel comfortable and safe at the place that they recreate. And if you walk a little further out those doors, you'll come to our pool. It's where children in this community learn how to swim, learn how to compete and be part of the swim team that does extremely well. And they've even, after learning how to swim here, we've had one individual who's a lifeguard who saved someone's life who was drowning here in the city of Boston. That's the type of things that this institution provides for the youth who live in this neighborhood. But we don't only keep you well in these two rooms. We keep you well as you walk through the clinic and you go out the door and go to the left, you'll find a financial counseling office. And that's where every individual who lives in this community, who needs health insurance, who needs to find care, can go and receive that assistance from the people who work here. And if you walk a little further down the hall, you'll come across our Women, Infants, and Children program. They're also located within this building. And a few doors down, you'll see our tax clinic, where people who live in this community can have assistance. Accountants come for free and prepare those taxes for them. The return goes to those individuals, and the economic benefit spreads across this entire community. As you walk through the rest of the clinic, you'll come to see that we have a lot of language capacity, because we want people to feel culturally accepted here and part of the community. And we need to represent that on our staff, and we need to provide that diversity and that language capacity. Within these walls, we have a pharmacy We have a dental clinic. We have a lab, urgent care, pediatrics, women's health, adult health, radiology, and behavioral health. We were a medical home long before that term came from the ivory towers. The board and the founders of this institution knew something long before everyone else did. That if you put all of these support systems in one building, you are taking care of the whole health of the community. And that's what we do best. We keep you well. So speaking of keeping you well, there couldn't be a better person than Joe Kennedy to come and officiate our ribbon cutting today. Joe has represented the core values and the mission of this institution throughout his life. Since 1979, he formed Citizens Energy Corporation, providing heating assistance for the poor and the elderly. He's keeping people well. That program has been stretched across the nation to 23 states. For 12 years on Capitol Hill, Congressman Kennedy devised creative, innovative approaches to addressing social needs in housing and home ownership for working Americans. He also passed health care legislation to provide access for our veterans. We are overwhelmed to have you here with us today, Joe. Thank you for joining us.
Thank you, gang. Thank you so much. Thank you. Thank you so much. Now, as far as I'm concerned, the test of whether or not this speech went well is whether or not when I'm walking back, I can throw the canes away. What do you think? You know, Walter, what do you say? Anyway, I just want to thank, first and foremost, each and every one of you for coming here today and for celebrating another renewal for this wonderful institution. I tell you, of all of the organizations that make up this city, the history of this place where we are sitting right now has had so much to do with not only saving that youngster who we just heard about from a lifeguard that learned to swim here, but there are hundreds and thousands of children that got through a sickness, that enabled a family to get a night's sleep, to help people when they're just plain sick. But it does, and it has done so much more than that. So much more than that. I remember just 10 years ago or so, we held a hearing right in this room where I got almost all the congressional delegates as well as the senators to come and to listen to Iraqi war veterans who couldn't pay their heating bills. So we have people that we send overseas to fight for us. And they come back to their own local community and they can't even get enough money to stay warm. This institution took in thousands of families just like the Kennedys. My grandmother grew up very close to where we are right now. And it was institutions like this that welcomed her and her family. You know, I was going to tell you a funny little story about my family, but on the way over here, I was talking to my wife, Beth. So can I ask Beth to stand up for a second, please? Thank you. Thank you very much. And I just, when we were driving over here, I just remembered this this just story that happened when I was a little boy. I was about maybe 11 or 12 years old, and I was walking with my older sister, Kathleen, across the lawn at what we would call the big house, which was where my grandparents lived in Hyannisport. We were walking across the lawn, and my grandmother came out onto the porch, and she asked us to come in. So Kathleen and I went into the big dining room, and she sat us down, and then she said, "Can you sit right here?" And she went into the back where we knew there were these old albums of pictures from like 50 years ago. And this was, 50 years ago. So it was a long time ago. And she, had this picture on the front of a newspaper. I think it was like the Record American or something. And it had her father standing on the Wright brothers plane taking off in Boston, right? So they'd flown the plane up here. So Kathleen and I think she's going to show us all these pictures from when her father was mayor of Boston. But she doesn't. And she takes out the newspaper, and she opens it, and she goes right to the back pages. And she said, this was what on the front page of the Record American. And let me show you what was on the back page. So you flip to the back page, and there were want ads after want ads after want ads. And every single one of them had 4 words: no Irish need apply. And she said to Kathleen and me, you never forget what this family went through with a lot of help from a lot of other people. And there's a lot of people whose blood and sweat have gone before you to give you what you've got. And never, ever, ever take for granted who you are and what you stand for. Because you owe a debt to people who came before you, who had to fight so that you have all of this. And ladies and gentlemen, that is what this place is about. That's what it's about. I was, when I was about 12 or 13, again, I was sent up here to Milton Academy. They liked me about as much as I liked them. But anyway, that's another long story. And I was playing football, and I got hurt pretty badly. So I was on these things. Well, they weren't quite like these, but anyway. I could either kind of ride the pine and then hang around for the winter, or I could try to find something else to do. So I looked, and I found that there was this thing called the Dorchester House. And it had a program to teach children of immigrant families how to speak English. And they were looking for teachers. Not that I was a teacher, but they were looking for people who could speak English. Let's put it that way. And so I would walk on crutches from Milton Academy down to the lower mills, and then I'd take this little trolley that goes from Mattapan to Ashmont, and then I'd get on the train from Ashmont to Fields Corner, and then I'd walk into this building, and I'd go upstairs, and there was a room about as big as, it looked like it was about as big as this. And they just put me in this room with 2 chairs, with me and this one little kid who couldn't speak a word of English. And we sat there, week after week, day after day, reading to each other and having a few laughs and yucks in between it. But it taught me so much about how hard the work that you do is every day. This is not an easy trail that you've chosen. For all of you that have chosen to give back with your life, You know, under Michael Dukakis, when he was president, Phil got this title, which was he was secretary of all secretaries. And yet he still couldn't type, you know? I mean, but he has done so much to set this country's healthcare policy on the track that has led to what President Obama was able to get through. And every time I hear people say, what has President Obama does? I tell you, you look at all those millions of people who now have health coverage that didn't have it before him. So what I'm here to tell you is that, look, my dad, when he became Attorney General, most Attorney Generals want to be known as having thrown a lot of guys in jail. And he was not opposed to throwing guys in jail, as Jimmy Hoffa and a lot of other people found out. But, you know, the truth of the matter is that what he saw was that communities all over this country were not able, because they weren't given the resources, to look out for their own people. So the jobs began to dry up. Manufacturing moved away. And the jobs for people of color in particular in this country just evaporated. Blacks had moved out of the South and come north because of the racial prejudice, which wasn't any different up here than it was down there. It was different, but it was at the heart the same. And the truth of the matter is that what he realized is that if you could make the community itself a place where people just like you cared about it, and if you fundamentally, in your heart of hearts, cared about your community, then all sorts of changes take place. All of a sudden, the schools have parents that care about it, that are interested in what's going on, and what kind of teachers and what their children are learning or not learning. They have a sense that they need health care, that you shouldn't be waiting for your child. I know exactly, because all of us, no matter what your financial situation, if you have children and they get sick in the middle of the night, where do you take them? Everybody takes them to the emergency room. But what we need is a place that we can go in the community where you're going to get good quality health care and avoid having to make that trip to the emergency room, which will save this country and the taxpayers and those rich Republicans all the money that they want. So, you know, to me, all I really wanted you to know is that that health center movement really came out of the Office of Economic Opportunity. Think of that, Office of Economic Opportunity. You know what office that came out of? That came out of my father's Attorney General's office in the Justice Department. How many times have you seen someone who is committed to justice in this country start a program called the Office of Economic Opportunity? It is exactly the opposite of what we stand for right now. And we have got to get back to the sort of values that build ourselves, that recognize the self-worth of the people that work in this institution. I met a fellow when I was just standing here, and I asked him what he did, and he said he was an eye doctor. And I said, where do you work? And he said, I've worked here for 30 years. Well, where is that fellow? Did he leave? He's probably saying, that's how he's looking. And I just said to him, you know, if you'd have gone to work when you got out of college, if you'd have gone to work for one of the big Boston hospitals or some other for-profit institution, would you make more money than you do right now? And he went, Walter, you and I need to have a talk. But what he then said was exactly what I found, is that I don't care how much money you make. If you help out one other human being, if you just look out for someone else, the joy that that will create in your heart will make you feel so good. It is so much better than making more money. It's so much better than doing things that help you versus helping someone else. And when you look at what Jim Hunt, what Phil Johnston, what that fine doctor, what all of you, I don't care what you're doing in your living here. What I do know is that most of the people, when I get sick and go into Mass General, it sure does seem to me that the people that have the crappiest jobs in those hospitals are all people that come from these neighborhoods. And, I sometimes wonder what would happen to those little discs in the bottom of a urinal unless people were willing to go and do that to help their own families so that they could eke out a living so that their children could have a better life. But that doesn't mean that big institutions have a right to roll over those that help the poorest and most vulnerable in this country. And that's what DotHouse Health is about. And so you now have 3,000, from the first day that Jim is talking about, where Columbia Point, what's the name? You got to work on the names. DotHouse Health is moving in the right direction. So what I just want you to know is that this is a joyous day. This is a great day. This is a day where Dorchester is turning another page, where this will continue to be that center of excellence for your families and for the families that make up Dorchester. They will, in Fields Corner, they will have this center to come to. And they will also be able to access some of the best health care at the community level. And God forbid, should you ever have a serious disease, these guys can get you a bed in the 5 best teaching hospitals in America. All happen to be located in my old congressional district. No, I would so much rather have authored the legislation that my Uncle Teddy did to expand the number of health centers to 3,000 than any more money that could go to hospitals that already have as much as they need. So I want you to know that you are part of the change in America. You are on the cutting edge of what this country is going to be in the next century. And it is exactly what you do with your working lives that is going to make those changes possible for thousands and thousands of other families just like yours. So, ladies and gentlemen, take umbrage and take strength in what you do. What you do is important. What you do makes this country great. What you do is what separates this society from so many others around the world. So I want to thank you for all the work that you do and that you're going to do under the name of DotHealth. Thank you all very much.
thing to me when he came into the hall. He said, "I hope the new name isn't going to take away the community part of this room, of this institution." And I said, "Absolutely not. It's only encompassing it and spelling it out more for the people who are part of this community." I'd like to ask Senator Linda Dorsini-Forey to come up and say a few words before we do the ribbon cutting.
Good afternoon, everyone. It is an honor to be here with all of you today in celebrating the renaming and the revitalization and rebirth of what was formerly Dorchester House Multi-Service Center that is now DotHouse Health. I'm here on behalf of my colleagues as well, Representative Dan Hunt, who is working on your behalf, working during the budget cycle. This is budget week to fight for community health centers. We're happy that Aaron Walsh is here, his legislative aide on his behalf. I want to thank Reverend Lavoie and the incredible members of the Board of Directors. Please stand, the Board of Directors, if you're here. Thank you for your work. I want to thank the incredible staff at Dorchester House Health, at DotHouse Health, for all your work over the years. I want to thank, obviously, Jim Hunt for incredible work he's doing with the Mass Associations of Community Health Centers. Congressman Kennedy, thank you for your leadership, thank you for your vision, but thank you for speaking here today and for sharing your story. Give it up for the Congressman. From your humble beginning in 1887 as a settlement house for newly arrived immigrants to Boston, I commend DotHouse for your achievements and your continued growth. It's an honor to serve as your state senator, and I thank you for your dedication in advancing the lives of children and families in our neighborhoods for over 125 years. Health centers, as was mentioned, is such an important, vital resource here in the city of Boston. Not only because they reduce and you reduce hospitalizations and emergency room visits, but because you deliver quality health care, which is tailor-made for the community you serve. Health centers such as this one are so involved and intertwined with the community that they can identify the needs of its patients quickly and efficiently. That is why they are called community health centers. Not because you are just located in our neighborhoods, but because you are part of this community. A lot of people use terms like continuum of care and wraparound services without explaining what those words really mean. Well, this is what it looks like. As you heard today, once you come to DotHouse Health, whether it was Congressman Kennedy when he was in high school, came here to teach English, or the eye doctor that's been here for 30-something years, once you come inside, you stay. Or you come back again, because this place has had an impact.
So let's hope these are sharp enough. On the count of 3, if you'd all yell DotHouse Health. 1, 2, 3.